Yeah, okay.
Yeah,
How was your session in Jaipur, sir?
it was very good actually, around 200 people. And then the faculty and the residents for the talk.
It was in the
was-
medical college, sir?
It was in Mahatma Gandhi Institute of Medical Sciences. Yeah, medical college. Yeah.
Yeah, okay.
So there is another going on in Karnataka API chapter. So
Yeah,
I just
no,
said,
we are all there.
I just said hello, and then Dr. Satish Chandra was there. Yeah.
We have
We will be joining that.
4 of you, Dr. Satish Chandra, sir, Dr. Bengamma, Manjari, and you. 4 of you are there.
Manjari is there. She will be giving a talk.
But she's here also.
Yeah, maybe she has to.
That's the beauty of this, no? Online.
Multitasking.
So no, that's what my Corona webinar
I'm
article was.
multitasking.
Hello. I have only one Manjari, I have only one device with me. I don't have 2 devices on the airport.
I'm multitasking.
No,
Okay,
I have
I
only
think,
one device.
I think we can start now.
Yes, sir. I already opened the room, sir.
We cannot start without your introductory comments.
Yeah.
We have the most important part. You have to set the ball rolling, sir.
Good evening. Epilepsy is a common brain disorder in the world, affecting about 50 million people. And there are a lot of misconceptions in the society regarding epilepsy. So therefore, we have planned this public awareness program on this International Epilepsy Day. And I welcome you all on behalf of Indian Academy of Neurology, Indian Epilepsy Association, and Association of Child Neurology. To inaugurate this activity, we have Dr. Gagandeep Singh, who is the President of Indian Academy of Neurology and Secretary of Indian Epilepsy Association. He is the Professor and Head of Department of Neurology at Dayanand Medical College, Ludhiana. Warm welcome, Dr. Gagandeep Singh. I would also like to welcome international and national faculty for this session. We have international faculty, Dr. Majrul Mannan from Bangladesh, and Dr. Vaniga Singhe from Sri Lanka. Warm welcome to you as well. We have Dr. Meenakshi Sundaram, Secretary of Indian Academy of Neurology. He will soon join. Dr. Satish Chandra, who is consultant neurologist and epilepsy expert from Apollo Hospital, Bangalore. And he's a former Vice Chancellor of NIMHANS, Bangalore. So all this faculty, we have a very extensive and very learned and expert faculty for today's panel discussion. We have Dr. Bhuma Vengamma, who is the President of Indian Epilepsy Association, Dr. Manmohan Mendiratta. You heard him on TV some time back. He's the President of Indian Epilepsy Society, and he's from Delhi. Dr. Sangeeta Rawat, who is the Dean of KEM Hospital, Mumbai, and she's a chairman of epilepsy subsection of Indian Academy of Neurology. Dr. Chaturbhuj Rathod, convener epilepsy subsection of Indian Academy of Neurology. Dr. Manjari Tripathi, professor of neurology at All India Institute of Medical Sciences, New Delhi, and secretary of Indian Epilepsy Society. Dr. Sita Jailakshmi, she's a consultant neurologist and epilepsy specialist at Krishna Institute of Medical Sciences, Hyderabad. She's a EC member of Indian Academy of Neurology. Dr.
Good evening, sir.
Vinayan, who is a pediatric neurologist from Amrita Institute of Medical Sciences, Cochin. Dr. Mini Sridharan from is an epilepsy consultant from Dinanath Mangeshwar Hospital, Pune. Dr. Vijay John Sagar from Bangalore. Dr. Kalpana, Dr. Renu, and many other host of faculty. And the most important person, Dr. Shefali Gulati, who is a professor and head of child neurology at All India Institute of Medical Sciences, New Delhi, and she's a president of Association of Child Neurology. So warm welcome to you all, the faculty, moderator, and the people who have joined for this very important session of public awareness program on epilepsy. I now request Dr. Gagandeep Singh to say a few words and inaugurate the session. Thank you.
Thank you, Dr. Meshram sir, and the pleasure is entirely mine to be in the midst of such an illuminated faculty and experts. Dr. Meshram sir has already enumerated all the experts here, and this is for the benefit of the audience in this hall as well as on YouTube and otherwise. I mean, they are the real experts, and they are the best experts in epilepsy in the region. You know that epilepsy is one condition. It actually comes in a package. And there are some things in the package that we can definitely do without. And one of the components or one of the things in the package that we can certainly do without is the social stigma which comes along with epilepsy. And that is the theme of the International Epilepsy Day today. Today, the second Monday of February the 13th. And our aim is, our objective is, our vision, our mission is to end the stigma associated with epilepsy. So, ladies and gentlemen, I'm talking to the audience. Thank you for joining us. You are going to have a real treat. You're going to listen to some great amount of pearls. You're going to listen to a huge amount of expert opinions and good advice and good suggestions. So keep your ears and eyes trained onto the screen and to the computer audio, and you would really gain a lot from this particular webinar. I'm absolutely confident about that. With these few words, I would like to pass on the floor to Dr. Shefali Gulati, who is, as introduced by Dr. Meshram, she is professor and head of pediatric neurology at the All India Institute of Medical Sciences, also the president of the Association of Child Neurology. But it is entirely her hard work, I think so. Dr. Meshram's initiative, her hard work in getting this thing, organizing this webinar, getting all the experts that you will hear, despite many problems, unforeseen medical problems in the family. But she had her mission and her goal set, and she did all the hard work. So thank you, Dr. Shefali, for all that you have done. Thank you so much, and I would pass on the floor to you.
Thank you so much, sir, for your kind words, and thank you so much, sir, for the opportunity, as well as to Dr. Meshram, sir, and all of you who have joined as a esteemed panelist, as well as all the participants. Can I share my screen? Okay. So can you see my slides?
Yes, ma'am.
Yes.
Okay.
Yes.
Okay.
Put it on the slide mode.
Okay. Is it okay? Can you see?
Yeah.
Okay. What is stigma? Stigma is actually a bad and often unfair feelings that people in general have about a condition. And epilepsy, why are we talking about epilepsy? Yes, it is an International Epilepsy Day, as Dr. Gagandeep rightly pointed out, that International Bureau for Epilepsy as well as IAN-IEA have been having it on the second Monday of every year since 2015 for epilepsy awareness. WHO estimates that as many as 50 million people with epilepsy are there worldwide. So it is important for us to understand that we have to make them live a very good life. And we should understand that each one of us have the equal fundamental right to live, and all the, with all the respect and dignity, and with or without any comorbidities. So we will be going through a series of questions and trying to unravel and see what are the myths which are there, which are baseless, and how we can overcome, and how we can handle patients with epilepsy. So epilepsy के लिए हमारे को stigma हटाना है, कोई negative feelings हटानी है, with or without epilepsy, everybody, sabka right same hai, and 70% of people with epilepsy can lead a reasonably good life and seizure-free life like any one of us, with the proper anti-seizure medications. And we will start off with what causes. So basically, we wanted to stamp out the stigma, which is going to be very, very important, or expunge the stigma, which is very important. Bilkul hata dena hai. We have to do a wow. We have a panel of experts and with global representation also from our friends from Bangladesh and Sri Lanka. First question which comes to our mind is, what causes epilepsy? Are there any identifiable risk factors for epilepsy? Would request Professor Satish Chandra sir to enlighten us on that.
Yeah. As you all mentioned, epilepsy is a very common neurological disorder, which has affected about 50 million people all around the globe. And even in India, it has affected almost about 8 to 10 million people. The question which is always asked is, what causes epilepsy? I always say, I wish I know what causes epilepsy, because epilepsy is due to abnormal electrical activity from the brain or from the neuron, from a nerve cell, which causes epilepsy. I always compare that to an electrical activity with a short circuit. If there is a short circuit on the wire and suddenly an electrical discharge occurs, and that causes a shock, and that is similar to that. In the brain, there is a short circuiting which might occur, which may result in an electrical discharge from the neuron, and that produces epilepsy. Are there any identifiable risk factors for epilepsy? Of course, there are some causes for epilepsy which are known to occur from birth till death. Anybody can be affected. No man is exempted. No one is exempted. So when such a case is there, we should know what causes epilepsy. Are there any risk factors for epilepsy? It starts from the birth till the death. Anybody at any time can get epilepsy. But when it occurs at a different age, different factors could be responsible. For example, at the time of birth, you may have a problem, and that problem could be due to low oxygenation or birth trauma, which we say. That is one of the common cause for epilepsy. Or it could be a metabolic factor which could be responsible, like a low sugar level, hypoglycemia, or a low sodium level, or low calcium level in a small child can produce epilepsy. As the age advances, we always think in terms of infection, which could be responsible for epilepsy. Infection could be in the form of meningeal infection or brain infection. That means either the brain infection can occur or the coverings of the brain can have an infection which produces epilepsy. Then as the age advances, the common cause in an adolescent group is usually trauma. That means head injury. An injury to the head which can occur accidentally can produce a seizure. So we call that as traumatic epilepsy, post-traumatic epilepsy. So that is one of the common causes. Then you can have, as the age advances further, in a woman, there could be causes during the pregnancy, after the pregnancy, due to a venous thrombosis or the stroke which can occur. As the age advances further, we may have many causes for epilepsy in the form of cerebrovascular accident or a stroke in the common terminology, or it could be very rarely due to a tumor, which may be in the brain, or it could be in the form of a cyst, which can produce epilepsy. Like that, as the age advances further, even the atrophic brain can produce epilepsy. So no person is immune to epilepsy. There are many, many causes, but still, when you ask a question, what is the cause for epilepsy, we commonly say idiopathic. That idiopathic means cause not known. Most often, we may not be able to know what is the cause for epilepsy in majority of the cases, or even up to about 40 to 50% of cases, we may not know the cause. But we need to identify the certain causes which causes epilepsy and look at the epilepsy, and which depends upon at what age and what is the patient who has presented to you. Based on that, we always look at the various questions. And always the question is asked about the family history, which is very, very important. We always ask but very small proportion, which I'm sure we'll be discussing later on regarding the genetic factor which may be responsible for epilepsy too. That's why overall I can say we do not know the cause in about 50% of the cases, and we know about the causes in 50%, where many causes at different ages are responsible for epilepsy. Thank you very much. You're mute. You're mute.
न्यूरॉन्स जो ज्ञानांतों है उसके बीच में शॉर्ट सर्किट है, जैसे सर ने बताया, उसमें होता है। और जो मोस्ट प्रिवेंटेबल जो कारण है उसमें दैट विल बी बर्थ एस्फिक्सिया, बच्चे का देर से रोना, हेड इंजरी, बहुत प्रिवेंटेबल चीजें हैं, और न्यूरो इन्फेक्शंस। और एक और है जो कीड़ा है, जो न्यूरो इन्फेस्टेशन, जो न्यूरोसिस्टिक सर्कोसिस है, जिसके ऊपर डॉक्टर गगनदीप के अलावा और कोई बोलना नहीं चाहिए इसके अंदर, विद द एक्सपीरियंस ही हैज, जिसके अंदर वो सब्जी फल अच्छी तरह धो के नहीं खाते हैं, जिसकी वजह से वो कीड़ा दिमाग में प्रवेश करता है। ऑल दोस थिंग्स आर प्रिवेंटेबल वाले कॉजेज हैं, वी हैव टू अंडरस्टैंड। तो बेसिकली इसमें कोई भूत प्रेत नहीं है, कुछ नहीं है, छुआछूत कुछ नहीं है। सो वी अंडरस्टैंड कि इट इज लाइक अ एनी अदर मेडिकल डिसऑर्डर, यू नो। तो इसीलिए दैट इज इंपॉर्टेंट कि वी अंडरस्टैंड। Next question, Dr. Bhuma, say I will be requesting 1 second, it is stuck. Yeah. A 35-year-old male fell unconscious a week ago in his workplace. There was frothing from his mouth and he could not recall the episode. He became normal within a few minutes. His doctor said that it could be a sign of epilepsy. Ma'am, how do we confirm the diagnosis of epilepsy?
Confirmation of the diagnosis of epilepsy is mainly by the history alone. Like epilepsy, that each seizure episode will have a prodrome phase, a aura phase, an ictal phase, post-ictal phase. When the person fell unconscious, before that, there could be something called prodrome. You should elicit about that part of the history, which could last from 6 to 24 hours before the episode, whether he had any headache or any other myalgia, something like that. Then just before the attack, you call it as an aura. That is very important from the point of diagnosis of epilepsy, because it helps you from the localization from which part of the brain this has fits or a seizure has arisen. And based on that, aura symptoms like that could be just before few seconds or few minutes before he became patient became unconscious. These aura again depend, these symptoms depends upon which part of the brain that see these seizure discharges are rising. Suppose if there is something like olfactory lobe, they have some peculiar smell. If they have something from occipital lobe, some sound of a visual symptoms. If there is something from temporal lobe, maybe related to memory problems, like or related to some hearing noises, or if it is from the sensory symptoms like one half of the body becoming numb, or there is some paresthesias, it could be from the parietal lobe. That part of a history we could elicit from the patient. Of course, after he becoming unconscious, you should see how long he had become unconscious. Again, you should check whether once he regained consciousness, is there any weakness on one half of the body, or if there is a history of incontinence, whether he has got a post-ictal sleep or myalgia. All those things we should elicit history, because if there is a history of tongue bite, that also will help you for the diagnosis. Because most of the time what we have seen is this epilepsy diagnosis, before you make, we should always exclude seizure mimics, which are there different from children versus adults. In children, most of the time, breath holding spells may be mistaken for an epilepsy. And similarly, in elderly people, micturition syncope, people who are standing while passing urine, especially males, they fell down unconscious, they may have one or two tonic jerks, they may be mistaken. That's why before you make the diagnosis of epilepsy, we should always see that we have exclude the seizure mimics, the commonest like febrile convulsions, or breath holding spells, syncopes, or it could be another important thing is a psychogenic seizures are a non-epileptic attack disorders, especially in young girls. They may resemble like that. Patient will have a movements, tonic-clonic movements, but there may not be tongue bite, there may not be incontinence, there and these episodes, usually the seizure lasts for 2 to 3 minutes. Very rarely it may last more than 5 minutes. But in a case of psychogenic seizure, it could be usually preceded by some stressful event, or it occurs in the presence of many people, and it may last for longer. There may not be postictal events. That's why before you make the diagnosis of epilepsy, make sure that you have excluded these events. Another thing, important thing is syncope. Most of the time, especially in the young school, they're standing in the prayer for a long time, suddenly they fell down. It could be vasovagal syncope or in elderly cardiogenic syncope. The first and foremost is we have to exclude all these seizure mimics, and after making this diagnosis of epilepsy is again basically from the history which we take from a eyewitness or whatever the component patient remembers. From the patient point of view, we should elicit the history and make sure that you make the diagnosis of epilepsy. And subsequently, we may do EEG for confirmation, but normal EEG will not exclude the diagnosis of epilepsy. Of course, imaging we do to find out the cause for epilepsy, but for the diagnosis of epilepsy, it is the clinical history alone. But most important nowadays, even with the video recording of the episodes, sometimes in the anxious time, parents or onlooker may not be able to remember all the sequence of events which we ask. That's why now we suggest, because everyone is having a mobile phone. With the mobile phone, with the video recording of the episode, if you record it and show to the doctor, it will be very easy for the diagnosis of epilepsy, because EEG also may be normal. That will not confirm the diagnosis. That's why the diagnosis of epilepsy is only by history, and proper history from the caregiver as well as the onlooker, whoever is the eyewitness, or from the part of the patient in a partial seizure, whatever they can remember, we can take the history. Thank you.
Thank you, ma'am. So this becomes more important in pediatrics, where you are taking from parents. You're not giving yourself, the parents are there. तो important है कि seizure mimics, उसके साथ मिलती जुलती कुछ mix up तो नहीं हो रही चीजें, क्योंकि बच्चों में और बड़ों में different कार्य हो सकते हैं जो दौरों की तरह लग रहे हैं पर दौरे नहीं है. जैसे मैम ने बताया, जो कि EG वगैरह रूल आउट नहीं करेगा, और मैक्सिमम चीज है सीजर का डिस्क्रिप्शन, जो कि आजकल बेटर रहता है. सबके पास स्मार्टफोन है, तो उस समय वो रिकॉर्ड कर लो. जितना मैक्सिमम इंफॉर्मेशन उससे मिलता है, वो उस और किसी भी इन्वेस्टिगेशन से नहीं मिलता, क्योंकि ईजी करके हम रूल आउट नहीं कर सकते हैं. न्यूरो इमेजिंग, सीटी एमआरआई करके कारण जान सकते हैं. डॉक्टर जॉन, ये जो नॉन एपिलेप्टिक इवेंट्स हैं, उसमें साइकोलॉजिकल एस्पेक्ट्स का क्या इश्यूज रह सकते हैं जो कि इम्पोर्टेंट है, बच्चों में ज्यादा होते हैं? आप कैन यू प्लीज टेल वट एवर द साइकोजेनिक कॉम्पोनेंट कुड बी देयर in the non-epileptic, and how you as a child and adolescent psychiatrist would look up for these patients, because it is very important unnecessarily, because we have also been getting patients who have been on PNE and are on 3 or 4 drugs, and obviously they're not going to get control.
Good evening, ma'am. At the outset, thanks for your invitation to participate in this webinar, which is very apt to spread the awareness about this important neurological condition. So when we talk about the non-epileptic events that may mimic the true seizures that we see in persons with epilepsy, as Vengama madam had pointed out, it is more common in the adolescent age group, that too the prevalence is higher in girls compared to the boys. And the usual stressful situations what we see in this age group is that the academic stress, especially these children, either they're towards the latter part of the middle school or the high school level, where academic stress is one of the common factors. And also factors like bullying by the peer group, or in the home context, actually they have interpersonal conflicts with their parents. And also we see that in some of the situations, the parents themselves, their what we call the parenting style that may be very harsh punitive kind of parenting style towards the children. And sometimes this may be precipitated like by some recent events, like say, for example, the loss experience. One of the common loss experiences is the failure in exams, or it could be related to illness in a close family member, like a parent, or even some serious kind of life events, like separation between parents after a period of marital discord, or the serious illness in the parent, which mandates the hospitalization of the parent. And during COVID time also, we had seen like especially many of the adults, when they developed COVID, they had to undergo this quarantine, and some of them had to be hospitalized. During that time also, we saw children coming with this non-epileptic events. There also could be more personal level for this adolescents. Severe elicit, generally what happens is it may take some time, because in the first instance itself, when we are collecting the history, in some of the cases it becomes difficult, because this mimicking the true seizures can be to a great extent, and sometimes differentiating may become difficult, and that's where a period of close observation, maybe with a brief inpatient admission, may be required. And it requires good liaison between the treating neurologist as well as the treating psychiatrist or child psychiatrist. And sometimes, like what we do is we take the help of our clinical psychologists also, because these children may not communicate about this, especially what is there in their mind. So some of the psychological tests or psychometric tests may be very valuable in bringing out this information. Thank you.
Thank you, Dr. John. We have seen that, house tree person test is a very simple test, which we're doing when you ask that to draw a house and tree and a person. And then we are able to understand many aspects, and it has helped us in many of these patients. And also for the non-epileptic things, like people of, the self-stimulating behaviors, this breath holding spells where everybody talks about and knows, but things like gratification and self-stimulating behavior gets missed, and they are on 5 drugs and coming to us.
And in fact, the frequency also, sometimes what we see is it may be too high frequency. Sometimes they may be falling down almost some 40-50 times, and typically these episodes are very brief lasting. They'll just fall down for a minute and get up, and usually there will be no injuries. There will be no incontinence, either urinary or fecal incontinence, and there will be no post episode amnesia or any confusional kind of states. So these are some of the differences. And but this can happen along with certain other somatic symptoms in these adolescents, where the adolescent may, at times when these episodes are not happening, keep talking about some non-specific kind of somatic complaints, like recurring abdominal pain or headache, which keeps changing between different sides. In general, some weakness or fatigue kind of thing, which when we extensively investigate, there will be no medical cause that will be found.
बिल्कुल that is what is there. As Dr. John ने बताया कि psychological aspect हो सकता है, उसमें देखना है कि उनको तनाव है कि क्या issues हैं, वो handle करना है. We have to have to keep a high, we have to have keep suspecting whether there is going to be a psychogenic issue, but always rule out organic. I felt we cannot miss a single organic, but have a high index of suspicion for having psychogenic where the component is. There is the next question is a scenario where a lady asked that my husband has been recently diagnosed with epilepsy, but his EEG and MRI reports have turned out to be normal. Should he really be taking anti-seizure medications? Dr. Mehdi Ratta sir, you're at the airport. Will you be able to answer? Or
thank you, Dr. Shefali. Am I audible?
Yes, sir. You're audible and partially visible. Completely visible. Yeah.
Okay, thank you. It's a very important question, and this not only comes मैं हिंदी एंग्लो इंडियन में बोलता हूँ ताकि आपको अनुवाद नहीं करना पड़ेगा.
सर आप इंग्लिश में बोल दीजिए. इंग्लिश में बोल दीजिए.
हाँ, वही एंग्लो इंडियन एक ही बात है. तो ये बहुत अच्छा क्वेश्चन है, जो कि पढ़े लिखे, जो एजुकेटेड हैं वो भी पूछते हैं, और ना एजुकेटेड हो वो भी पूछते हैं कि हम दवाई क्यों लें. दवाई के साइड इफेक्ट हो सकते हैं और बहुत साइड इफेक्ट्स होते हैं. तो उस सिचुएशन में ईजी और एमआरआई डिपेंड करता है ईजी कब की गई. EG जरूरी नहीं है सब में पॉजिटिव हो, अगर जब दोहरा हुआ है उसके इमीडिएट बात की जाए तो 60% में चांसेस है उसमें कुछ नुक्स निकल सकता है। एक हम कहते हैं एपिलेप्टिफॉर्म डिस्चार्जेस, एक कहते हैं कि होने के इमीडिएट बाद उसमें जो एक्टिविटी स्लो हो जाती है, और सेकंड MRI जो इडियोपैथिक एपिलेप्सिस है उन सब में नॉर्मल होता है। बट MRI एक अच्छे प्रोटोकॉल में होना चाहिए जिसको एपिलेप्सी प्रोटोकॉल कहते हैं। बहुत सारे छोटे छोटे लीजन हो सकता है कि वो उसमें ना आए, और उस सिचुएशन में एपिलेप्सी प्रोटोकॉल पे एटलीस्ट 3 टेस्ला पे MRI होना चाहिए ना। EG भी नॉर्मल है, MRI भी नॉर्मल है, अब क्या करना है? अगर बार बार सीजर पड़ रहे हैं और एस्टैब्लिश्ड एपिलेप्सी है और अनप्रोवोक्ड सीजर्स हैं, प्रोवोक्ड होते हैं, जैसे पहले बताया गया कि जैसे शुगर कम हो जाए हाइपोग्लाइसीमिया, कैल्शियम कम हो जाए हाइपोग्लाइसीमिया, सोडियम कम हो जाए एल्डरली में हाइपोनेट्रीमिया, कुछ दवाइयों से सोडियम कम हो जाता है, कुछ डिहाइड्रेशन, खाना पीना कम हो उससे हो जाता है। उन सिचुएशंस को छोड़ के अगर डॉक्टर ने उसको लेबल कर लिया कि बार बार सीजर्स हो रहे हैं और ये एपिलेप्सी है, EG नॉर्मल भी है, MRI नॉर्मल भी है, तो मेडिसिन शुरू करनी पड़ेगी। It will all depend which type of medicine is to be started, what dosage are to be given according to body weight and the habitus of the person, और किस तरह की देनी है वो टाइप ऑफ एपिलेप्सी सिंड्रोम पे डिपेंड करेगा। तो ये मेरा आंसर है कि ये जरूरी नहीं है कि दोनों नॉर्मल हो तो एपिलेप्सी नहीं हो सकती, तब भी हो सकती है और दवाइयों की जरूरत पड़ सकती है, वो एक्सपर्ट डिसाइड करते हैं। अगर बच्चे हैं तो डॉक्टर शेफाली के पास जाएं, डॉक्टर जितांगी के पास जाएं, डॉक्टर विनयन के पास जाएं। अगर एडल्ट हैं तो मेरे पास आएँ, डॉक्टर सतीश चंद्रा के पास आएँ, डॉक्टर मंजरी के पास आएँ, और जो भी एडल्ट न्यूरोलॉजिस्ट हैं उनके पास जाना है। तो फ्रॉम देयर विजडम, फ्रॉम देयर एक्सपीरियंस वो आपको बताएंगे कि सही रास्ता क्या है और उस रास्ते को आपने अडॉप्ट करना है। और आजकल जो ज़्यादा मिसगाइड होते हैं, डॉक्टर गूगल साहब, डॉक्टर गूगल जी और गूगल साहब, उनकी सहायता नहीं लेनी है और जो असली डॉक्टर हैं उनकी हेल्प लेनी है और वो आपको गाइड करेंगे। थैंक यू सो मच।
Thank you, sir. Thank you very much. Dr. Jitangi.
I didn't see her in the panel.
Yeah, she's there.
Okay.
Dr. Jitangi was there. Dr. Jitangi, yes, what are the basic principles of drug treatment for epilepsy, and how do we decide the choice of anti-seizure medications?
Shefali, I will leave in between. I have a flight to catch.
Thank you, sir. Grateful to you.
Thanks.
Grateful to you for joining and sharing.
Thank you, Shefali. Thank you so much. And so glad to join you once again. And hello to all my friends from India and also from Bangladesh. Thank you so much for having me today. And I'm glad to contribute to this question. So what would be the basic principles of drug treatment? I think the first principle would be that we would have to have the diagnosis of epilepsy being established. So that's the very first thing, that we need to be sure that we are actually treating a child or an adult who has true epilepsy. So I think the first 4 questions were all very much emphasizing on the importance of a correct diagnosis. So once you make the diagnosis, the main thing that governs our treatment is, why do we need to treat the patient? Of course, we want to avoid a recurrence. So diagnosis and treatment are 2 different things, because sometimes it could be the patient's choice, and particularly some other epilepsies where they're just a mild sensory manifestation, where the patient and also probably the physician might think that, we can watch without treatment because it's just only a simple seizure or a seizure with retained awareness. So the second thing would be, you decide, okay, what do we want to achieve through treatment? So in most of the cases, of course, they are not simple, as I just mentioned. So we need to start the patient on treatment and try and maintain them seizure-free. So at that point, we consider so many factors. The first being, what is the type of epilepsy? So the type of epilepsy actually helps us to understand what type of treatment to give. And then based on which we would make the choice. And then we move on to understand, okay, what kind of medication do we need to treat this patient? And in the choice of the appropriate treatment, the most important factor that governs our decision, or the main principle, would be how efficacious your choice is on this particular kind of epilepsy. So we go on to, involve many principles. For example, we need to treat the epilepsy with minimum drugs, with the most efficacious drug. And of course, therefore, we start treatment with one medication. And it's only if it is needed, and also once we give a reasonable, decent trial with that medicine that you think was the most efficacious for the type of epilepsy that you chose the medication, that you consider going on to a second medication, and that instance also as a monotherapy. So we move on to treat with the minimum number of medications and with the most efficacious. And if the need arises, we may move on to add on others to achieve seizure freedom. So there comes other principles like, choosing medications which are cost effective, and also medications which have least side effects. So the ideal, there are many principles which we consider in all together. The thing that we try to achieve would be to keep the patient seizure free with the most efficacious medication, choosing the most ideal medication where this patient has probably no or minimum side effects, and try and maintain on these medications for the shortest recommended duration that we need to keep the patient on. Okay, so let me decide. I think So I elaborated on a little bit of the other things as well, on how do we decide on the choice of anti-seizure medication. So it's like anti-seizure medications are like a plate with a lot of sweets where there are many choices, different types of candies. So you would have to have a principle on which you would choose. So there are several governing decisions which we just alluded to. And we would try to choose the one which treats the correct epilepsy that we have diagnosed, and that is the most efficacious medication that we know. Of course, there would be many, and your choice would be governed by evidence that supports for use of these medications in different conditions. And then you would choose just one medication and try to control your epilepsy with the best choice that you can give while giving minimum adverse effects to the patient.
Thank you, Dr. Jitangi. तो हमें करेक्ट ड्रग को चूज करना है जो कि उस कंडीशन के लिए अप्रोप्रिएट है, मिनिमम डोज पे यूज करना है जितना है, और कोशिश करके एक ड्रग करना है, जरूरत होगी तो रैशनली ही बढ़ाना है. सो इम्पोर्टेंट समथिंग व्हाट इज इम्पोर्टेंट इज दैट if the child has a episode of seizure at home or anywhere in the hospital setting, what to do? I think this should be known to everybody. I personally feel that CPR and rescue therapy for seizures should be known to all citizens of the country. We don't have 911 services and we cannot crib for them. We'll have to have and empower everybody to do the same. So I would now request Dr. Meshram sir, would you be guide us into this regard? Dr. Meshram sir?
Yes.
Yes. So domiciliary management.
Yeah. I think the most important thing is whenever you find that any person get a seizure, what is important is that what you should not do is very important. Most of the times what happens, when somebody gets a seizure or the people see that the person has got seizures, then they try to hold the person, they try to put, if there is a clenching of the teeth, या दांत बैठ जाते हैं तो वो मुंह में कुछ चम्मच डालते हैं या कुछ कोई चीजें डालते हैं, तो that should not be done. Then they try to hold the person, so that should not be done. Then some people, they come and they try to, bring some onion or bring some shoes or chappal near the nose. And, that doesn't stop the epileptic attack. And some people, try to put the water into the mouth. So all these things are dangerous, because if the patient is unconscious or getting seizures, and if you try to put the water in the mouth and ask him to drink something, that it can go into the lungs, and the patient can have respiratory problems, and the patient can die. So don't do this. If you find a person, somebody is getting the attack, try to see that he is safe, he doesn't get hurt, his head is safe. If you have some soft thing, you rest his head on that soft thing, or put his head on your thighs. Turn him on one side, on any side, right side or left side. You see that, so that his saliva doesn't go inside the lungs. And after a few minutes, the attack automatically stops. So you don't have to worry. But if the attack remains for a longer time, you should call an ambulance and send the patient to the hospital. Another important thing is that if the person has the attack remains for a longer time, and you have got at home, you have got midazolam spray or tablet, bound dissolving tablet to stop the seizures, that can be given. Some people are worried that, if there is a clenching of the teeth, how to give the tablet. You just put the tablet by the side of the cheek and it will get absorbed. So it is important that what is to be done and what is not to be done when you see a person with seizures. Thank you.
थैंक यू सर। ये तो इम्पोर्टेंट है कि उसको पोजीशन कैसे करना है ताकि उसको चोट नहीं लगेगा और उसका एस्पिरेशन नहीं होगा, कि खाने के पदार्थ अपने स्टमक से जाके रेस्पिरेशन में नहीं जाए, क्योंकि कई बार वो सडन डेथ भी हो सकता है। तो दिस इज वेरी इंपॉर्टेंट एंड वी हैव टू सर अबॉर्टिव थेरेपी आल्सो।
थोड़ा साइड में
डॉक्टर संगीता, कैन यू म्यूट योरसेल्फ? यस सर। सो इसीलिए इम्पोर्टेंट है। नेक्स्ट क्वेश्चन हम आते हैं कि वी लिव इन अ जॉइंट फैमिली। A week ago, my 24-year-old brother had an episode of seizure. My sister, who lives with us, had been recently diagnosed with epilepsy and she's on some anti-seizure medication. Is epilepsy contagious? Dr. Sangeeta Rawat.
Hi, Shefali.
Sorry.
एपिलेप्सी कंटेजियस नहीं है, एक दूसरे के संसर्ग में आने से नहीं होती है, मगर आपके फैमिली में अगर दो लोगों को हुई है तो उसके कारण ये हो सकते हैं कि आपका या तो आनुवंशिक मिर्गी है जिसकी वजह से जेनेटिक्स है जो आपके दो लोगों में फैमिली में रन हो सकता है, या फिर सम कॉमन सोर्स ऑफ इन्फेक्शन जैसे शेफाली ने बताया न्यूरोसिस्टिक सर्कोसिस या ऐसा कुछ है जहां आपके खाने के हाइजीन में कुछ प्रॉब्लम हो, तो वो एक ही कारण से दो लोगों को फैमिली में हो सकती है। सो आप मिर्गी के पेशेंट के साथ रहने से आपको बिल्कुल एपिलेप्सी होती नहीं है, उसका कारण अलग ही रहता है और आप मिर्गी के पेशेंट के साथ रह सकते हैं, उनके साथ खाना भी खा सकते हैं और सब कुछ कर सकते हैं। इट इज नॉट ए कंटेजियस डिजीज।
थैंक यू। माय कंटेजियस नहीं है, ये आपको क्लियरली बताया है अभी। नेक्स्ट क्वेश्चन है, माय सीजर्स आर गेटिंग कंट्रोल्ड ऑन इवन ऑन 3 medications. Are there any other therapies beyond medicines to treat epilepsy? Dr. Vinayan, can you please guide us?
Thanks, Shefali. See, when seizures are not getting controlled even on 3 medications, that means that you are having a resistant epilepsy. So, ये resistant epilepsy बोल सकते हैं। So, what happens is when you have this is a different types of disease. Actually, it is a little difficult to treat. So, what we need is a proper evaluation. That means this is a going from the standard therapy. So there are several options here. So if it is what we call a focal epilepsy, so the basic thing is it has to be investigated properly. There are different investigations possible. We have to take an MRI and we have to do a video EEG and then see whether what kind of seizure is this, whether it is a focal seizure, is there any brain damage or any there are specific diseases like focal cortical dysplasia or mesial temporal sclerosis. There are different names for this. So the main thing is it has to be investigated properly in a major center because there are certain treatments available. That means you can go for an epilepsy surgery or there are specific treatments like dietary therapy bhi hai. So it is called ketogenic diet. So there are several centers which are doing ketogenic diet and there are different types of diet, less restricted diet bhi hai, ketogenic diet bhi hai. So that means, so you have to have a proper evaluation and then along with the medicine should not be stopped, but the patient has to undergo proper evaluation to see whether anything else can be done other than medications, other than the drugs. So dawa ke alawa kuch kar sakta hai. So basically surgery and dietary therapy, these are the two major things. So that is available in many centers in India, many major centers. So go there and get evaluated properly and then take it forward according to the advices of the doctor.
थैंक यू डॉक्टर विनयन. ये इम्पोर्टेंट है कि जो डाइट है ये नहीं है कि हाई फैट है या लो कार्बोहाइड्रेट है, मतलब कीटोजेनिक डाइट या मॉडिफाइड एटकिंस या LGIT जो है लो ग्लाइसेमिक इंडेक्स अपने आप शुरू कर सकते हैं. दे हैव टू बी डाइटरी एडवाइस हैज टू बी गिवन विद द पीडियाट्रिक न्यूरोलॉजिस्ट, न्यूट्रिशनिस्ट कंबाइन करके आपके लिए स्ट्रक्चर्ड प्रोग्राम बनाते हैं, पूरा प्लान बनाते हैं विद फूड एक्सचेंजेस. अपने आप नहीं ऊपर नीचे करना है. ये नहीं है कि अब अपने डाइट में ज्यादा घी भी खाना शुरू हो जाओ तो है. इट इज नॉट लाइक दैट. इट हैज टू बी इंडिविजुअलाइज्ड और प्रिस्क्रिप्शन जैसे दवाई का होता है वैसे ही आपको डाइट प्लान मिलता है. सो दिस इज इम्पोर्टेंट कैन इट कैन बी डेंजरस इन सम वेज, यू नो.
Yeah, sure.
Yeah. Next question ये important है. A 16-year-old teen girl with Dr. John with epilepsy has recently been found to be withdrawn and isolated from friends ever since she had an episode of seizure at school in front of her parents, in front of her friends. She remains sad most of the time and with intermittent episodes of crying spells. What is your approach in managing this girl? I think Dr. John?
Yes, madam. So here in this situation, like you can see that the girl is an adolescent. She's attending school. She has been diagnosed with epilepsy. Probably she's on treatment. So there has been an episode of seizure at the school in front of her friends. So like what usually happens in these kind of situations is the classmates and her friends who were there in the classroom, and even to some extent the teachers, how they reacted at that point of time becomes very important. We see that like some of them would not have had the awareness about these kind of problems, health problems, and they would have become very anxious or panicked, and sometimes they would have like earlier Satish Chandra sir had mentioned that the causes of epilepsy. So sometimes there will be a lot of myths and misconceptions about this, saying that she's fallen down and she's having some movements of her limbs. This could be because of some evil spirit, etc., like that. And then they might have reacted differently, and even children would have shown some kind of fear, saying that this girl had this. And so after this experience, the girl would have become very upset about that, like how the other people would have reacted at the classroom. And more importantly, one of the important things here is that the feeling of stigma in the girl, like saying that no, this particular problem has manifested in the school in front of my friends, in front of my classmates, teachers. What will they think of about this? And how will they respond to this in future? How will everyone look at me? Like, they'll always treat me like a person who is having some illness, and they will not interact with me properly. Nobody would like to make friends with me. So these kind of thoughts sometimes children develop. So it is important that, and also you see that after that she has become somewhat withdrawn. There are intermittent crying spells and she's sad. So we need to definitely establish a rapport with the girl, and also have few sessions with her and elicit her mental status, how she's feeling about this particular incident that has happened in the classroom in front of her classmates. And because the sadness and crying spells are mentioned, we have to evaluate whether she has underlying depressive symptoms. And if depression is present, it has to be managed with appropriate psychotherapeutic, as well as in cases if it is a severe depression, moderate to severe depression, we may have to add some medication for the management of depression also. Overall, no, I would like to say that this situation can happen for school-going children and adolescents when they have epilepsy. And generally, when we make a diagnosis, when we work with the parents as well as the children, this is something, as part of the diagnosis, the education when we do to the families as well as to the children, we need to explain to them that it can happen at certain situations like that, but they should not be feeling ashamed about it. Like any other medical condition, this is also a genuine neurological condition, and treatment is available. Very good anti-epileptic medications are available, and other whatever suggested by neurologist has to be followed. And they can continue their education, they can continue their all the other activities with due precautions given by a neurologist. They need not feel like they need not get depressed or emotionally very much disturbed about it.
Thank you, Dr. John. It is important कि हमें counseling करनी चाहिए बच्चों की and parents की पूरी family के लिए coping strategies बताने चाहिए. And I feel that we as pediatric neurologists or adult neurologists, besides giving anti-seizure medications and talking about domiciliary management, positioning and abortive therapy, we have to talk to them from the psychological aspects also. And I think because we do not have every child going to a psychologist or a child and adolescent psychiatrist, so we need to be ensuring that they are counseled properly. Next question, Dr. Mini. An 8-year-old boy with epilepsy had his last episode of seizure 3 years ago, but for the last 1 year, he has cognitive decline and significant behavioral problems. He remains irritable, hyperactive, and has inappropriate speech. Will there be any change in his management? Dr. Mini?
Of course, we have discussed about all aspects of epilepsy so far, and along with that, we should also understand that there are other comorbidities or accompaniments with epilepsy, especially in children as well as in adults also. There can be other issues because of the underlying disease or the cause which led to the seizure disorder or epilepsy. So in this case scenario, especially, the seizures seems to be well controlled according to the history. But there is a cognitive decline and continuing behavioral problems, inappropriate behavior and hyperactivity. So one issue is that first of all, we have to see whether the seizures actually are really controlled or not with medications. There may be subtle seizures which may be missed, still going on, and there may be significant EEG changes in spite of seizures well controlled, which may be affecting the scholastic performance of a child. So once we have ruled out those situations, then next thing that we'll have to see is that whether this hyperactivity and behavioral issues are part of the underlying etiology which has led to the epilepsy. So that will have to be addressed in such a case. We'll have to evaluate for what exactly is the problem with the child with the learning, and with the help of a psychologist, we'll have to see. And if he is hyperactive, we can use both behavioral therapy as well as we can use medications if required, if it is not getting controlled. Another issue is that, again, it could be because there may be, even though it is a small child, still they may be depressed. Even in small children, the depression can be like masked. And we have to just talk to the child to see why he is hyperactive, irritable, or why he is not interested in studies and all those things. If really whether it is a cognitive decline or is it like a depressive condition which is causing an apparent feeling that there is a cognitive decline. last but not the least, most of the parents, when they think that the child has epilepsy, most of them, they rear the child as a special child or somewhat in a different way. So most of the demands of such children will be met. Sometimes the issues of regarding epilepsy, their disease, etc., will be explained in front of the child and narrated to the other relatives. So all these things make the child think that they are a kind of a special kind of a person, and they do have undue inappropriate behaviors and undue demands, which when not met with, they become hyperactive and oppositional behaviors can come. So depending upon which factor has led to these so-called cognitive decline, one has to see whether there is any ongoing condition along with epilepsy which is leading to a real issue, and then that will have to be managed, or if it is a psychosocial issue, that will have to be addressed. And of course, there can be behavioral therapy as well as management of the associated hyperactivity. Yet another thing is that the child has become seizure-free for the last 3 years. Whether to continue with the medications or not is yet another question. Some of the medications which we give for epilepsy may be associated with some irritability and hyperactivity. So if one has to weigh the risk and benefit of treating epilepsy, and if the epilepsy is well controlled, and if the child is remaining seizure for 3 years, and after evaluation by the the neurologist or the pediatrician, it is most of the children or most of the patients, seizure freedom of 2 to 3 years, we will be able to bring down the medications and stop the medications. So if the therapy itself is causing, or the drugs are causing the adverse events, then we will have to consider stopping the drug also after evaluating the child. So these will be my considerations in such a case.
Absolutely, Mini. Thank you so much. तो इम्पोर्टेंट है इसके अंदर देखना कि कुछ साइकोलॉजिकल इश्यूज हो रहे हैं कि नहीं, क्या वो ड्रग का साइड इफेक्ट हो रहा है कि नहीं, ऑल दैट हैज टू बी केप्ट इन माइंड. बट वन थिंग मोर, आई वुड आल्सो डू, आई थिंक वुड बी गेटिंग एन EEG डन to be ensure कि there are no discharges which are there, because sometimes what happens is they are not having seizures. So non convulsive may you may have certain times behavioral. Yeah. That's what. That's what
seizures may be ongoing, and so we have to evaluate for that.
Yeah, absolutely. Like you've completed holistically, so that is how we should be looking at it. Now, next question, Dr. Manan. I will be requesting you. I have epilepsy, but I am taking medications properly. And my last episode was 6 months ago. Can I be involved in sports and aerobics? And is there any recommendation for the same? Manan? Dr. Manan? Dr. Mini, you can continue.
He's there, but
Dr. Mini, yeah. you want to answer? You can answer.
No. I unmuted because I thought you wanted me to speak now. Okay.
Yeah, I wanted you to speak because Dr. Manan is not. Because please.
I think there is a problem in the.
I'll just contact him. I'll contact him. I'll call him up. But meanwhile,
Manan is here. I can see.
No, he's there. We can see him, but there is some problem in the mic, I think so.
Dr. Manan, can you hear us? Dr. Manan, can you speak? We can't hear you. Can you unmute yourself, sir?
We were talking to him in the beginning of the.
Yeah. I remember I said hi. Dr. Manan, hello. We can't hear you, sir. Is your okay?
I think he will log off and then
log in. Yeah.
So you can probably continue with.
Yeah, Dr. Mini or Dr. Jithangi, anybody can please. Dr. Mini, please.
Most of the cases are in most of the cases, like in epilepsy is well controlled. Most of the patients can get involved in sports and aerobics. It should not be a problem. Actually, this in getting involved in sports and aerobics improves the seizure control, the general health of the patient, as well as gives them a self-esteem, actually. So we should not be overprotective and try to prevent them from getting involved in sports and aerobics activity. But there are certain sports which may be dangerous for the patient or to the nearby persons also, like when they are like in car racing and other things, when seizures are not well controlled, or swimming unsupervised, or such kind of activity can be dangerous to the patient. So it depends upon what kind of a seizure the patient has, how long the seizures are controlled, whether the seizures occurs only during night. In this situation, the seizures are well controlled for 6 months, and there should not be any restriction for such a person to undergo like get engaged in sports or aerobics. Only thing is that if the person is swimming or like in climbing, like such activity in heights, so somebody should be there to protect the person if their mishap happens. That's all. Otherwise, we should not be restricting people. So there are certain recommendations like ILA task force on sports activity, which can be like they have grouped the sports into type 1, type 2, and type 3 kind of sports, which are already mentioned, like people with like less risk, and they can get involved in all kinds of sports, or there are sports item which will be dangerous to the person but not to the persons in the surrounding, and those which are going to be dangerous to the persons in the vicinity. So depending upon that, the certification of fitness for attending sports activity, sometimes in such a case, involvement of a neurologist should be there, and based upon the individual merits and demerits, we can advise regarding getting engaged in sports activity. But of course, if the seizures are well controlled for 6 months, I think we should not be restraining too much.
Absolutely. Thank you, Dr. Mini. So basically, like, supervise hona chahiye for something like swimming and all and climbing, right? Thank you. And next question I'll address to Dr. Jitangi, because it's a 6-year-old girl, and then I will come. One second. Dr. Jitangi, my 6-year-old girl has been recently diagnosed with epilepsy. She had 4 episodes of seizure in the last 3 months despite taking medications. What extra precautions as a parent should I take?
Thank you, Shefali. I hope you can hear me.
Loud and clear.
Yeah, okay. So recently diagnosed and 4 episodes of seizures in the last 3 months. Okay. Okay, I guess you're talking of a child who is taking the medications, and I hope there is, good compliance. And then we are talking about the situation, what extra precautions as a parent. So first thing, if I'm the clinician, I would really want to know, this is a 6-year-old girl, but is actually the medication really going into the patient? And also, do the parents understand, and they are giving the medications as I have prescribed? That would be the first thing. And even from the parents' perspective, they may be thinking that they are giving the appropriate medication. I would, go back to check whether it is the same prescription, it's the same medication which has been given, so that I ensure that this is actually a case where the seizures are not yet controlled, right? So 4 episodes of seizures during the last 3 months, sometimes we may have to consider how frequently the child has actually had the seizures before. So if the seizures were happening like on a daily basis, and now it is actually coming down, then that means there is probably some control, and probably we have not yet achieved the control. So therefore, I would have to talk to the parents and make them understand that, they need to continue and follow up with the doctor, so that, give time. And it could be that we are really achieving control, but we need some time to fine tune the doses and the amounts of medication that we are giving to the child. So while this is happening, so seizures are happening, and how do mothers and fathers look at safety? So we have to warn them that depending on the type of seizure, sometimes it could be just a seizure which is a focal aware seizure, and we know that these seizures are not causing any risk or harm to the child. So the child would just come and complain. In such a situation, or if the seizures are continuing to happen in the night where there is no risk or danger to the life of the child, or risk of trauma, we could again talk to the parents, make them feel reassured that although we are trying to achieve control, that the child does not have a potential danger. and that they could engage in, it's a 6-year-old child, the child can go to school and, participate in normal, school activities and normal day-to-day activities, so that the child kind of leads a normal life while we are in the process of achieving seizure control. But in the case of, it's like the seizures have been the same and we don't kind of like see any improvement. And while the physicians are trying on different medications, I think the parents will have to adhere to measures which would safeguard the patient. For example, if it is a patient who is getting sudden loss of consciousness and there is a generalized tonic-clonic seizures, so there is the risk of danger to the child. So we'll have to address those issues while the child continues to go to school and also take part in normal activities like another child. So the parents will have to keep a close eye, avoid situations where the child is not under supervision, avoid situations where there is a risk, for example, in activities that they do, like, play or cycling or swimming, where we don't really know whether the seizures can occur at any point of time. So the child can participate in activities, but it'll have to be with close supervision while we work with the physician until we achieve seizure control.
Absolutely, and the medications have to be taken on time, and it's important that in pediatric age group the medications are measured very well, and it is not to be in the wake of caps or teaspoons. It has to be with syringes properly measured, and if the child vomits within half an hour of taking the medication, they should repeat the medication. All these things are small things which are very important to understand. And thank you, Dr. Jitangi, for all the things which has been said. Dr. Manan, what contributes to stigma related to epilepsy, and what are the strategies to overcome it? Now that the theme is also stigma, it's very important for us to understand. And Bangladesh and Pakistan and Sri Lanka, Nepal and India, all of them are in close proximity. So we have similar social cultural stuff going on, in our society. Please. Dr. Manan, you're not audible again. I don't know, something is wrong. Dr. Manan, you can't hear you. Something is wrong. Dr. Manan, can we log out again and log in again with the thing? And maybe Dr. Chaturbhuj can answer this question meanwhile. Dr. Manan, you can hear you right now. One second. We could just speak again, Dr. Manan? We can't hear you. Something is wrong, actually. I think you just...
Sir, maybe you logged out and logged in again.
Log out and log in again, sir. And Dr. Chaturbhuj can answer the question. I'll come to you. The next question comes to you, Dr. Manan.
So I think stigma and epilepsy go hand in hand. And this year's theme for the International Epilepsy Day is to stamp out the stigma. So very important question. I think stigma, there may be multiple reasons why stigma has been associated with epilepsy. One is that from ancient times, it has been believed that epilepsy is because of the spirit entering into the body. And this myth has been propagated over the years and over the centuries. So that is one of the reasons that epilepsy is considered a stigmatized disease. Second, which I think is the manifestations of the epilepsy. And sometimes generalized tonic-clonic seizures or other kind of seizures can be very dramatic and they occur episodically. And because of this dramatic manifestation, the community or the other lay person will believe that these are probably features of the mental disorder or some supernatural power coming to the epilepsy, especially when the people have this very violent movements which cannot be restrained and which is believed that because of the supernatural power coming to the people. So that this kind of manifestation of epilepsy contributes to the stigma. Third thing is many patients with epilepsy have associated neurological disabilities, especially mental retardation, depression, and psychosis. And because of that, it is considered that people with epilepsy usually have a mental disorders, or they are incapable of leading a normal life and all these things. So I think all these factors, multiple factors, and fourthly, especially which is important in developing country, and these myths and big are propagated because of the lack of awareness and illiteracy in the larger part of the country, especially if you go to the rural areas. And because of the illiteracy and because of the people who are taking advantage of this illiteracy, many quacks and many other faith healers which take advantage of this and propagate these myths. And all this, I think, contributes to the stigma of the epilepsy. How to remove or what are the strategy? I think these are the what we have been doing today. It is one of the most important strategy to improve the awareness in the community regarding the epilepsy and to bust the myths and superstitions associated with epilepsy. So the only way it is possible is to spread the awareness by whatever means, by this kind of webinar, by the now with the social media. You can use Twitter, Facebook, and all kind of social media to improve the awareness. And secondly, as I understand, as the literacy rate will improve and people become more educated, they are likely to be improvement in the stigma associated with epilepsy. Thank you.
Dr. Shefali, in this connection, I would like to add one more point. Like in our curriculum, school curriculum, at least AOCN should take initiatives to include these as like in the adolescent age. No, we can teach children regarding all these things and to avoid stigma. So this should be part of our curriculum, actually.
Absolutely, absolutely. Very rightly said. Very rightly said. Dietary therapy already Dr. Vinayan has mentioned. Dr. Manjari, how safe is taking medications for epilepsy during pregnancy? Are there any specific precautions which are required? And what is the effect of epilepsy on pregnancy and pregnancy on epilepsy?
आज मैं यहाँ ये बताना चाहूंगी कि जो महिलाएं हैं उनके लिए गर्भवती होना संभव है और ये बहुत जरूरी है कि ये महिलाएं गर्भवती होने से पहले अपने डॉक्टर के संपर्क में आएं। अगर एक यंग लड़की को या दौरे पड़ते हैं तो बहुत जरूरी है कि कुछ ऐसी दवाइयां उनको दी जाएं जो अगर उसकी शादी हो और शादी के बाद वो बच्चा प्लान कर रही हैं वो उसमें सेफ हो। और आपको जान के ये बहुत खुशी होगी कि ये सारी दवाइयां हमारे देश में उपलब्ध हैं। तो ये बहुत जरूरी है कि प्रेगनेंसी पहली बात तो प्लान्ड हो और प्रेगनेंसी के पहले ही एक छोटा सा विटामिन आता है जो बहुत लो डोज 1 मिलीग्राम के डोज में हम स्टार्ट करते हैं दवाइयों के साथ। 95% pregnancies are safe and जो बाकी 5% है उसका भी रिडक्शन किया जा सकता है सही दवाई के साथ, सही डोज के साथ। ये बहुत जरूरी है कि दौरे कंट्रोल्ड हों और ये भी बहुत जरूरी है कि दवाइयां ली जाएं। अक्सर पाया जाता है कि कहीं सुनी हियरसे से कोई नेबर बोल देता है या कोई फ्रेंड बोल देता है कि दवाइयां सारी बंद कर दो, प्रेगनेंसी हो चुकी है तो दवाइयां बंद कर दो। ये बहुत हानिकारक हो सकता है और ऐसी एडवाइस पे नहीं जाना चाहिए। सही डॉक्टर न्यूरोलॉजिस्ट के पास जाके सही मात्रा में दवाई लेना बहुत जरूरी है। उसके अलावा जो बोन हेल्थ है वो भी कुछ दवाइयों से कमजोर होती है और प्रेगनेंसी में ये बहुत जरूरी है कि ये बोन हेल्थ के बारे में भी देखा जाए। इसके अलावा 12वें हफ्ते में, 16वें हफ्ते में और 18वें हफ्ते में कुछ जांचें होती हैं, जैसे एक प्रकार का अल्ट्रासाउंड होता है जिसको हम लेवल 2 अल्ट्रासाउंड बोलते हैं और सिर्फ अल्फा फीटोप्रोटीन लेवल होते हैं, ये हम कराते हैं बच्चे की हाल जानने के लिए। तो ये सब हम अगर कहें कि ये जानना बहुत जरूरी है कि जो भी महिला है वो पहले से ही अपने डॉक्टर के संपर्क में रहे, प्रेगनेंसी को प्लान करे, जो सही दवाइयां हैं जो बच्चे को हानि नहीं पहुंचाती हैं वो ले और सही मात्रा में ले बिना छोड़े, तो नॉर्मल जिंदगी और नॉर्मल प्रेगनेंसी व्यतीत करना संभव है।
you, Dr. Manjari. Thank you very much. एंड कई बार कई दवाइयां चल रही होती हैं प्रेगनेंसी में एडोलेसेंट गर्ल्स को, जिसमें हमें लगता है कि प्रॉब्लम हो सकता है फीटस को, तो बेटर यही रहता है कि पहले से ही वो अपने डॉक्टर के पास जाके चेंज करवा दे वो, लेकिन वो बाद में ना हो, बिकॉज प्रेगनेंसी प्लान नहीं होती है मोस्टली हमारे यहाँ पे। तो इट्स बेटर कि जब वो मैरिज होने लगी है या कुछ है तभी उससे पहले ही मेडिसिन चेंज कर दें। एंड ऑब्वियसली एक बहुत इंपॉर्टेंट है कि फैमिली में बताना है कि मैरिज के टाइम पे कि क्या प्रॉब्लम है। लोग कई बार होते हैं मैरिज के टाइम बताते नहीं है, तो वो बहुत बड़ा इश्यू हो जाता है और दवाइयां कहीं मिस कर देते हैं, बहुत प्रॉब्लम्स हो जाती हैं। डॉक्टर मनन, आई होप वी कैन हियर यू। हाउ विल एपिलेप्सी अफेक्ट द सोशल लाइफ एंड शुड आई डिस्क्लोज इट माय डायग्नोसिस इन माय वर्क प्लेस, in my surroundings, in my family? What do you think?
I hope that you can hear me.
Yeah, thank God.
Yeah,
thank God. Yeah.
So we must understand we are living in an Asian country. So Asian country, epilepsy affects social life totally different way than European and other countries. That's we have to agree because it's a lifestyle. That's we say. So social life, first coming with the office and job place. We must inform my colleague next to who is working next to my desk or next to me, because your epilepsy seizure can be seen anytime. It is coming like a click and thunder. So if your colleague, your office don't know it, then it will be very difficult for them to handle you, to give you a treatment, support you, and also sometimes there is more chance to lose your job than hiding it, than to talk with them. And you must show, if you need, your office need, your working place need, you show a paper from a doctor that you are under treatment and you are under medication, your seizure is controlled. And obviously the work you are doing in your office is not a risk of your health if you get a seizure. So someone doing some machinery work, and if you have a seizure, then obviously you can have a big accident and you can cause an accident for the company. But otherwise, if you're doing the desk office work and others, it is very okay. Lots of people in our countries and our neighboring countries and Asia and other countries also work with epilepsy. So it is nothing too special, but people working next to you must know that some of them must know that you have such a episode sometime, and what they should do when you have some seizures. In social life, obviously it is difficult. Whatever we say, whatever we do, it is really hard to make people understand that epilepsy is a normal thing and it can be happen with anyone because it's Asia. So we say that very easily that we understand epilepsy and it's a normal thing. No, it is not a normal thing. If you're having a seizure in a social life, anywhere during any events, obviously your friends, families will take it not in an easy way if they don't know it earlier that you are having such things sometime. So that's my answer, I think.
Are there any epilepsy support groups available, and what is the role of support groups in NGO, Dr. Manan?
Oh, okay. There are lots of support groups available in Bangladesh, and two things I want to mention. One is the NGOs working with epilepsy. Nowadays, because last 10 years, we are more giving efforts for autism and NDDs. So with the help of the media and with the help of the other efforts and others, autism and NDD is coming up very upfront, and lots of people know more about those things than epilepsy. But epilepsy is more easily controllable, more easy issues. So obviously in our country, there are lots of support group available online, offline, but we must find out one next to our place or where you live, because connecting with them will help you to go mingling with them, to understand, going with the social programs with them, and lots of things we can learn from those groups, how to handle it, how to support these people, and that will ensure social situation acceptance and against the stigma. If you want to face the stigma, fight against stigma, understand the stigma, we must work with support groups and NGOs
which is next to your home or your places. And with the role of the support groups and NGOs is huge. We know that a government cannot work alone for any issues. So with the support groups and NGOs, we can face this together with other government initiatives. And you can already see that how much successful the autism and NMDD's effort was. And we can do the same thing for epilepsy to ensure more support for our people with or person with epilepsy to be acceptable in the society with the help of support groups and NGOs. Thank you.
Thank you, Dr. Manan. एक दूसरे से पेशेंट्स और पेरेंट्स कैन टेक लॉट ऑफ हेल्प. एपिलेप्सी एज सच अलग से डिसेबिलिटी नहीं है वो 21 में, लेकिन इंट्रैक्टेबल एपिलेप्सी की वजह से जो इश्यूज होते हैं वो मल्टीपल में आ जाते हैं. डॉक्टर सुजीत, क्वेश्चन टू यू. आई हैव बीन टेकिंग मेडिकेशंस फॉर एपिलेप्सी फॉर द लास्ट 3 years. The last episode of seizure was almost 2.5 years ago. How long do I need to continue on medications?
Good evening all. This is very important question that 2.5 years I'm seizure free now. So how long duration of treatment I need? Here the importance is what type of syndrome or what type of epilepsy you have, because few epilepsies like childhood epilepsies are like age related, so they will as the age increases they will disappear or we can stop the medications. But few epilepsies we may require to continue the drug for longer period, especially when it is like juvenile myoclonic epilepsy or GTCS on awakening, like idiopathic generalized epilepsy. And focal epilepsy, we can definitely, if it is a 2.5 years seizure free, we may do EEG. If EEG is normal, then we can slowly taper the medication and we can stop. But there are few epilepsies, like I said, generalized epilepsies, idiopathic generalized epilepsy or genetic generalized epilepsies, where we need to continue the drug.
Thank you very much. Now we are just coming to an end of the thing. We'll just come few points which were there. I just want us to understand that we have to empower the parents. So we have to have patient information material available in the regional language, their local languages, and videos to tell about domestic management of seizures. We've been trying to train the pediatricians, giving them evidence-based guidelines, and we have had 16 sessions which are there in the QR code on the YouTube, which had around 16,000 hits, and we made a Word document. And we also took out Association of Pediatric Neurology IAP guidelines for the pediatricians for managing epilepsy, and we also have patient information material and QR code. Now we have taken out messages from various professionals from across the globe and parent and self-advocate, which will be there. Dr. Gagandeep sir, can I start it and end it with it after that? They started?
Yeah.
Yeah.
Yes, please. Can we hear?
So could you not hear it?
No, I cannot hear it. I'm not sure about the rest.
No, it's not audible.
Yeah.
Can you hear? 1 minute. Do you have to make some mode in the settings to make it here?
Yeah, probably.
Mansi, can you help?
Optimize video clip. See if you can. Can you hear?
Yes, ma'am.
Department of Pediatrics AIMS. No. And I'm currently president of Association of Child Neurology India. Epilepsy is one of the most common neurological diseases present both in pediatric and adult age groups. And WHO has estimated that as many as 50 million persons are having epilepsy. The International Bureau for Epilepsy and IAN-IEA, International League Against Epilepsy, have started this International Epilepsy Day on the second Monday of each February of each year since 2015 for increasing awareness. So this year it comes on 13th February of 2023. The theme this year is stigma. What is stigma? Stigma is bad and often unfair feelings which people generally have about any particular condition. There are a lot of misconceptions about epilepsy, that it is contagious, it is because of evil spirits, or it is a mental illness. These all are unbased and are false. Up to 70% of persons with epilepsy can lead a practically normal seizure-free life on these anti-seizure medications with good quality of life. And one should remember that each person with or without epilepsy has the equal fundamental right to live. We have to have a humanistic aspect addressed in all the interactions with them. And let's vow today to expunge this stigma attached to epilepsy. Thank you.
Epilepsy is not an infectious or a contagious disease. Children with epilepsy can eat, play, sleep and stay with other children without any fear or hesitation of transmitting disease to other children. Majority of children whose epilepsy is well controlled with medicines can attend to a normal school and do all the activities in school like other children.
This is Professor Veena Kalra, ex-professor and head AIMS, speaking about social stigma in epilepsy, especially among school children. Stigma against epilepsy dates back to antiquity. We know in all religions it is expressed differently. We call it Mata Aati Hai. We said Jesus pushed away the evil out of a child to cure his epilepsy. We say Bhoot possesses the child. So there are all kinds of stigmas that are attached with epilepsy in children. But we have come a long way and these stigmas must be now behind us. The stigma in school children can affect, first of all, discrimination against admitting a child with epilepsy into school. Parents are often asked to write about whether the child has seizures or not. That should only be to empower the teacher to handle such a child in class and not to disallow admission of such a child into school. This is totally illegal. Second, schoolmates and school authorities must be empowered, must be taught and must be equipped to handle a seizure in school and not debar a child who has seizures from entering school or continuing school. Asking children with seizures to quit school because of seizures is again totally illegal, and parents must be aware of this effect and not permit the school to do this to them, provided the child is capable enough to conduct himself in school, to walk around with reasonable stability and to carry on his work. So epilepsy per se should not prohibit a child from any activity that the child can do otherwise.
Namaskar, I am Dr. Pratibha Singhi, Head of Department of Pediatric Neurology at Amrita Hospital, Faridabad. On this International Epilepsy Day, I would like to emphasize the fact that we really need to destigmatize epilepsy. In adolescents particularly, they feel stigmatized and this actually leads to poor control of epilepsy. These children are already struggling with problems of self-esteem and self-identity and making their own presence felt. They feel stigmatized because of peer pressure, because people, their fellow students, criticize them or laugh at them because they've had a seizure in front of others, etc.
Let's share the truth about epilepsy and dispel the myths. So epilepsy is a brain disease. It's characterized by abnormal electrical activity, causing seizures or unusual behavior, sensations, and sometimes loss of awareness. You'll find out more at internationalepilepsyday.org. So epilepsy is a treatable condition. As many as 70% of people with epilepsy could live seizure-free with appropriate drugs and with use of cost-effective and commonly available anti-seizure medications. The Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders, targeting on point 2.2, it aims that 80% of countries will provide the essential medicines and basic technologies required to manage neurological conditions in primary care by 2031.
If you are having an epileptic condition or having seizures, please keep a positive mind, as it will always help you to move forward. Be courageous and never feel low about yourself.
Friends, ladies and gentlemen, Monday, February 13, 2023 is the World Epilepsy Day. The International Bureau Against Epilepsy, the Indian Academy of Neurology, and the Indian Epilepsy Association have all given a call to end stigma associated with epilepsy. It pervades the entire lifespan of many people with epilepsy. So, ladies and gentlemen, let us make a resolve to fight stigma to its very end for all people with epilepsy. Thank you.
From Tirupati, my message on the occasion of International Epilepsy Day 2023 is, for many people living with epilepsy, the stigma attached to the condition is more difficult to deal than the condition itself and contributes to delayed diagnosis as well as a misdiagnosis. There are many misconceptions and myths are often contribute to stigma surrounding the epilepsy.
I must have written few hundred thousands of prescriptions for people with epilepsy and given advice to people with epilepsy and their caregivers. But this doesn't end with prescription. The most difficult part is societal stigma, increasing awareness and education about epilepsy among the masses. That's my responsibility. That's our responsibility to enhance awareness in the society and dispel myths and misbeliefs about epilepsy. Thank you. Have a wonderful day.
We have lots of type of stigma with epilepsy, and especially with children. They are facing big issues in their schools and with their surroundings. Nowadays, epilepsy is not a big issue. With proper treatment and management and help of the parents and caregivers and the teachers, we can face it. So don't stay at home and don't feel bad that you have epilepsy. Let's work together and face it.
Misguided stigma against our children suffering from epilepsy remains pervasive, including here in Malaysia. In Malaysia, a few of us have taken the initiative to increase awareness to alleviate the stigma of children suffering from epilepsy by conducting serial lectures, particularly among school children and also school teachers over the past few years. And so far, the feedback has been encouraging.
It is my sincere wish that we can all come together and overcome stigma, which is a major problem affecting all our patients. So let's join hands, work together, and let's see the end of stigma for patients with epilepsy.
People believe that this is incurable and that it's long-lasting, it's heritable, and that people who have epilepsy are incapable of taking part in everyday life. What we want to highlight and make you aware that epilepsy in 70% of people can be treated very easily with medication over a period of few years. They should participate and take part in all normal activities, be it schooling, education, recreational, and future profession, life, job, and families.
Hi, I am Dr. Lokesh Lingappa. Children with well-controlled epilepsy can play all kinds of games without any limitation. Allow them to live to their fullest potential.
Epilepsy is a chronic condition which is known to us from hundreds of years. Now, the 3M associated with this disease, myth, misconception and misunderstanding, has led to development of a lot of stigma being associated with this disease. Now, for children with epilepsy, society's behavior can be at times more damaging than the seizure themselves. So, on this occasion, I would want that all our fellow doctors, educationists, celebrities, politicians, let us all come together and work for destigmatization of epilepsy and improve the behavior and attitude of society towards these.
This International Epilepsy Day, let's come together and support our epilepsy patients. It is important to know that epilepsy is curable with proper treatment and guidance. So please come together
and help and support our epilepsy patients. Thank you.
Epilepsy, epilepsy is one of the common neurological disease in children. Near about 6 to 10 million persons suffering from epilepsy in India, more than 50 million in the world. And if it's diagnosed properly and proper treatment given in a proper time, more than 70% can be controlled or resolved and maybe seizure free for many, many years, maybe throughout life. So it's very important whenever the person is seizing or having convulsion of feet, you must get a consultation from either pediatric neurologist or physician or pediatrician who are nearby and clear your doubts, learn some about the epilepsy and the skills.
Epilepsy is a simple problem which can be treated with medication. So please don't discriminate patients with epilepsy. They have the equal chance to be treated in the society, and it is not a transmittable disease. They can eat, they can play, they can behave normally in a society. So treat them equally, don't discriminate, don't label, don't separate them. Thank you.
Parents of children with epilepsy often faces negative reaction from the society. Because of stigma associated with epilepsy, 50% people with epilepsy do not seek treatment. On this International Epilepsy Day, let's spread awareness about epilepsy, its scientific basis, treatment and outcomes.
On the occasion of International Epilepsy Day, my message for people with epilepsy is take your medicines regularly, sleep 8 hours, and live as normal as life as anybody else. Do not let stigma and discrimination impact your life. Live with the attitude, yes, I have epilepsy, so what? I can do what I want to do, and nobody can prevent me from learning, reading, working, and of course, feeling different than any other person. Thank you.
मिर्गी की बीमारी से हमें डरना नहीं है, झुकना नहीं है। निडरता से इस बीमारी का हमें सामना करना है। मिर्गी आने पर रोगी को जूते या पैंच नहीं सुखाना है, ना कि उसके हाथ दबाना है या पंजे की मालिश करना है। उसे हमें दवाई से, सर्जरी से ठीक करना है। मिर्गी की बीमारी कुछ साल औषध सेवन से दूर की जा सकती है। धन्यवाद।
The social consequences of having epilepsy are enormous. The most important problems people with epilepsy encounter in daily life often are not related to the severity of epilepsy, but due to the misconceptions about epilepsy in the general public. Therefore, on this International Epilepsy Day, creating awareness about epilepsy in general public is the most important priority so that people with epilepsy have better life.
Say that epilepsy is just another way of life, like our son had it, and we as a parents were very worried about it, but under the aegis of Dr. Shefali Gulati, he has been doing very well, and even in academics as well as in the organization where he was working also, it was just as normal as anything else. So it should be seen as a positive and just another way of life. Thank you.
Thank you, sir. Over to Dr. Gagandeep, sir.
Thank you, Dr. Shefali. Thank you for taking us through this entire spectrum of epilepsy and the consequences and how epilepsy should actually be treated and how it should be dealt with. Fantastic. I was listening to it very carefully, and thank you all the experts. Thank you for the lovely words of wisdom, the excellent expert comments, the suggestions. I think we will all go back. I mean, I'm speaking not just for myself, for everyone who was there at this webinar. We would go back much more learned, much more wise, and much more knowledgeable about the subject. I think there is absolutely no doubt about that. So thank you, Dr. Shefali, for really organizing this so well. All the hard work. I know I've been following you how all that you have done in the last few days, and that too in such a short period of time. So thank you very much, and I'm extremely grateful.
Sir, I want to thank actually before you, my TM residents, Dr. Akash and Dr. Kaushik, who have helped, and they have, because he could not get it formally edited, Akash edited it himself yesterday, and we got the videos till today. So in the afternoon, so it's been my whole team, sir. It is not me alone. It's the team of Child Neurology Division, Department of Pediatrics, and now AOCN, EB, and basically it's not me alone. It's the whole team.
I completely agree. I mean, there's no doubt about it. And so the entire team, but obviously you conceptualize the whole thing. And overall, I mean, the entire concept of, public awareness and the Indian Academy of Neurology, not just the Indian Academy, all the neurological bodies in Indian Epilepsy Association, Society, Child Neurology, all the associations. I think the driving force behind them is Dr. Meshram. So he has, in fact, he will tell us more about it, but the country's efforts in spreading public awareness, improving people's attitudes, has been appreciated at a global level, and that's largely due to his efforts. So the final word has to be from you, Dr. Mishra.
Yeah, thank you, Dr. Gagandeep. I think today's program was, the flyer was displayed on the WFN website, and it was also circulated in the social media. And whenever there is a discussion about having public education programs in other countries, they always look and they want to emulate that what is done by the Indian Academy of Neurology and what is being done by India in form of number of activities, the type of activities, and the awareness and involvement of the people, involvement of specialities, and the newspaper, print media, and electronic media. So whenever there is a discussion at the global level in the World Federation of Neurology, they always say that we want to do something, we'll do something, but not as good as what is being done in India. So thank you very much. It's all teamwork, and because we run the activities throughout the year, this is the first activity for this year. The next month we'll have the
Mishram sir, before you say bye-bye and close it, I want to appeal to you and Dr. Gagandeep as president of IAN. Sir, I'll tell you, most of the things are across lifespan, and they start from children and, and go on to adult. We have to look at the transitional care. And, one request, humble request is, if suppose common things like, are there, and we can hold all these awareness programs together with the AOC in India, with IAN, then it show a spectrum from pediatric to adult, and we can develop a transitional care program over the course of this year for various conditions. Just a humble request. I mean, you are the
sure. Yeah, Dr. Gagandeep.
I think that's an excellent idea.
Yeah. We because the basic idea is to create awareness among the public. It is the children, elderly people, geriatric population. We want to create awareness across all sections of the society, all the groups, the caregivers, patients, and everyone. So those who want to join this particular mission, everybody is very welcome. So I would like to thank Shefali and all the associations and all the panelists. I think it was wonderful discussion, and the audience that they have participated, they were attended in large numbers. And thank you very much, and keep looking for the activities of public education. Next month we'll have some activity. Every month there will be activity. The activity on the Zoom, on TV, So today at 10 p.m. on NDTV English, you will have the program about epilepsy awareness on television. So you can watch that program. It was displayed at 5 p.m. and another session will be at 10 p.m. So on NDTV, you can watch that program. Dr. Satish Chandra wanted to say something.
Sir, you're mute.
Sir is here. Okay.
Yeah, he's here.
Sir, you're mute. Satish Chandra, sir, you're mute. Unmute yourself, sir.
I'm sure you had a wonderful meeting and all of you have participated. In the middle, I have to go to the other meeting, which was there simultaneously by associations of physicians of India. That was the reason I had to move out from there. Both three of us were there in that meeting also. But I'm sure you have all discussed everything about epilepsy, which is definitely a treatable disorder, and all of us can contribute to remove the stigma from this society. That's all I can say. And we all work hard to remove the stigma, and then only we will be successful to treat our patients with epilepsy. Thank you.
And I would like to specially thank Dr. Mannan, who has joined from Bangladesh, and Jita Shri from Sri Lanka. And would like to, have future collaborations from the SAARC countries as well as other parts of the world, so that we can involve them in these activities. Thank you.
Dr. Manan, as long as you're there, I think Dr. Jitange has left. So please do join us, and do encourage your friends and colleagues in Bangladesh to join us for our activities. We'll keep keep you informed about our activities. You're more than welcome.
That will be great, and we will be happy. But I just want to add in one word, because we have a very good experience with autism and NDDs. Let's work together. We can sort out a plan for next 2 or 3 years for awareness building of the epilepsy. There, because we know for last 10 years experience how to do it nationally and internationally. Thank you very much.
Thank you. We have good friendships in the pediatric component of the pediatric neurology with Bangladesh. They're very close friends with us for long. Right, Dr. Manan?
Right.
Thank you, Shafali, for nice program. In between, I could join on and off. It was nicely conducted, nicely organized questions. Thank you.
Yeah, and the slides were very good.
Yeah, that's what.
Thank you. Thank you. Thank you.
Thank you, Shefali.
Thank you, Dr. Gagandeep. Thank you, Dr. Shefali. Thank you, IAN. Thank you, IAN.
Thank you, Shefali. Thank you,
Thank
all
you.
of you, for giving this
Thank you.
opportunity.
Thank you. Thank you, sir. Thank you for the opportunity.
Thank you. Thank you so much. Bye. Have a nice and good night.
Good
Thank
night.
you, Dr. Mishram.
Thank you, Mansi.
Bye.
Thank
Bye. Ah, thank you.
Good night. Thank you.
you. Good night.